All right, we're going to go ahead and get started. Welcome to this afternoon's press update from the Joint Information Center. As always, I start these with a huge thank you to our media partners, to the City of Dothan's IT staff and the county for being able to stream these to get out to our citizens and visitors to know exactly what's going on in our community. As most folks are aware, from yesterday's activities, the state health officer has issued a number of directives that are now applicable statewide that impact restaurants and facilities and daycares, and identifying what is considered essential services and essential workers that are still working. So we just wanted to get that directly from the Alabama Department of Public Health as an update for y'all. So we'll start with our local Alabama Department of Public Health representative, Mr. Corey Kirkland. He's going to come up and go over that. Again, I would ask that we try to hold questions toward the end. We'll follow that with what's changing or what's going to be implemented in Houston County from county services and county facilities, and then city facilities and city services, and then we'll open it up for questions at that. So Corey, if you'll come forward and help us.
Good afternoon. Thank you for having us here today. As he said, there was a significant change yesterday with health orders. So I want to go over a few things that's happened since March 13th and then go over some of the key points of the order from yesterday. On March 13th, Governor Kay Ivey declared a state of public health emergency exists in Alabama. On March 16th, in response to a rapidly growing number of cases of COVID-19 being detected in Jefferson County, Dr. Mark Wilson, the Jefferson County Health Officer, issued health orders with similar restrictions. Dr. Harris added counties surrounding Jefferson on March 17th, and Mobile County Health Officer Dr. Bernard Eichhold ordered closures on March 18th. All of those orders were very similar in nature, and they were also in result of continuation of cases in the state. There was a significant jump in Jefferson County, which prompted Dr. Harris to do the counties around Jefferson as a containment strategy. Even with that, over the night and through the day, we had more cases in Alabama. We're now up to 81 total cases in the state. Yesterday, Dr. Harris made the determination that he wanted to further restrict business in the state to help contain the spread of this virus. Some key points from the statewide health order from yesterday are: all gatherings of 25 people or more, or gatherings of any size that cannot maintain a consistent 6-foot distance between persons, are prohibited. This order applies to all events and activities that bring 25 or more persons in a single room or a single space at one time. All senior citizen centers are to be closed. Senior centers and their partners are urged to ensure that their clients continue to receive meals via curbside pickup or delivery. All private schools through grade 12, all preschools, child care centers with 12 or more children, except for those operated within hospitals, shall be closed. Prior to April 6th, a determination will be made about whether to extend those closures. All nursing homes and long-term care facilities will prohibit visitors except for compassionate care situations such as end-of-life care. In fact, that had already been done throughout the state. Our nursing homes and our extended care facilities had already been in contact with Montgomery through the office that regulates them for going on a couple of weeks. So they were already kind of ahead of the curve on that one a little bit. Any restaurant, brewery, or bar shall not permit on-site food or drink to be served for at least 1 week with certain provisions. Establishments may continue to offer food for takeout or delivery, provided the social distancing protocols, including maintaining a consistent 6-foot distance between persons, are followed. Establishments are strongly encouraged to offer online ordering and curbside pickup of food. Hospital food service areas are excluded, provided they have their own social distancing plan. And I know from our office yesterday and today, there's been a little bit of problem with what to do about daycares, salons. We fielded several questions yesterday and this morning. The state office is fielding questions about that. The administrators like me throughout the state pushed up our concerns and have legal, with Public Health Legal and the Cosmetology Board and others throughout the state have been meeting for the last few hours. There is an amendment to this health order coming. I do not have that in hand yet, but there will be an amendment to help clarify some of the confusion, especially with our daycares and with our salons and that sort of thing. One thing that I want to point out with this, though, with all of these things, is meant to help maintain that consistent 6-foot distance between persons. It's meant to stop the gathering where people are so close together that we can have that spread of the virus, whether it's through touching or if it's through coughing, through sneezing. The 6-foot distance is to help break that, that distance where if you sneeze and those droplets that may have that virus are not able to get onto that other person. And that's the whole point for the additional cleaning with your hard surfaces, your doorknobs, your bathrooms, those kind of things. Your hands, your sneeze etiquette, your cough etiquette, those kind of things are very, very important. I also want to thank some of the restaurants or all the restaurants in our area that have been working on this. We have several that have called us and said, we want to help, we want to do this right, we need a little bit of guidance. And we've talked with them and given them as much as we can. Some of them have said it's going to be difficult for us to maintain that 6-foot distance, and they've gone ahead and said we're going to close for a couple of weeks. We're going to close through the 6th, and we'll look and see what happens. If we can reopen, whether it's partial reopen or something, we'll do that. So we appreciate their attitude and their cooperation. A lot of restaurants immediately went to curbside pickup. They went to the drive-through, and that's been very helpful. We've had several daycares call with the same questions, and they're wanting to help. They're wanting to do it right, and I think the amendment that will come later this afternoon will help them to do that. So I want to thank them for their cooperation and thank them for reaching out to us. We've had a lot of calls where they end the call saying, we appreciate you picking up the phone and talking with us, and we certainly are here to do that, and we will certainly continue to do that. So again, one of the main things with this is that 6-foot distance. One thing that I've noticed from traveling around too is we really need, and Dr. Harris touched on this the other day, we really need people to take it serious. If you're in the grocery store, if you're in line, wherever you are, put distance between you and that person in front of you. Talk with your children, talk with your teenagers, talk with them about how to do that properly, why it's important. Even though young people are not affected by this, we still have a lot of populations in our communities that are very vulnerable to this. Talk a lot about the seniors, but there's other populations, people who have taken drugs for a sickness that is compromising their immune system. Maybe they're taking chemo, maybe they're doing other things that they just cannot fight off sickness as well as everyone else. Pregnant women, which has not been talked about a lot, but their immune system would generally be a little weaker. We don't want to do things that would possibly infect them. There is not a lot of evidence about the fetus and how that affects them, but the best thing to do, again, is with that social distancing, staying home, staying off the road. If you can do that, not only essential travel, essential shopping, helps to protect all of those groups. The seniors, those who are compromised immune system, all of those things. And also help keep our medical workers from being sick, keep from inundating our ERs and those kind of things, so we save resources for those that need it. I've noticed some people riding around 4 or 5 to a truck. It's warm, it's spring break, young people want to get out and go. Really talk with them about staying home. Talk with them about using the technology that we have now with FaceTiming and Skype and all those things to talk with their friends, but really bear down and stay home this weekend. Stay away from the stores unless you really have to be there. Those are the things that will really help us to, as they've been saying, flatten that curve, and hopefully by April 6th, we'll have evidence that it's okay to start lifting some of these orders. Dr. Harris does not enter into these things lightly. We understand that this is not only affecting our cities and our towns, but this is affecting those small businessmen, and we would love to release this as soon as possible. And again, I appreciate the cooperation we've seen from them, the calls that they've had, and we'll do our best to push out information to them as soon as possible. There's been a little bit of confusion, I think, on our website. I do want everyone to know that we are going to update that website as soon as possible. As soon as that guidance come out, that is priority number 1, so that we have someone for people to go and see that amendment to the order and be able to get some questions answered. I guess my final thought is, again, please take it serious. We really need the public's help. Stay home. Remember your cough etiquette, washing hands, your social distancing. If you don't have to go to a gathering, if you can postpone a gathering, that would be very helpful over the next couple of weeks. So thank you.
Thank you. Next up, I'd ask Director Chris Judah from Dothan-Houston County EMA to come up and update us on what the county's doing.
Thank you, Chief. I, too, want to thank everyone for attending and tuning in today. I want to thank our media partners. You're a great asset to us, and we really depend on what you do. I just wanted to touch on a few things. I want to go ahead and say, during this health crisis and economic conflict, and in a time of anxiety and fear, we're all working to sustain our reassurance and resiliency within our community. We did not seek, nor did we provoke this disruption in our lives. A true measure of one's strength is upon us, and how we respond to it will be proven in the next few days. It's time to be a hero for each other. It's time for us to help each other out and to be there for one another. We understand what's going on, and we'll do what's necessary to accomplish getting our communities back to a secure sense of normalcy, but it's going to take some time, and we ask for some patience. As for Houston County, we're taking measures to mitigate and reduce exposure to the virus. We will continue to ask people to follow the Alabama Department of Public Health and CDC regulations and guidelines. As of Monday, or actually as of immediately, the county will suspend all in-person proceedings at county-operated buildings. We will continue to serve the public in all county operations such as garbage pickup and et cetera. What we ask is if you have any business for county offices, please call ahead. Their staff will be there. Call them, see what your business is, see how to handle that. That way you might be able to accomplish that business, whether it be telephone or online, and it keeps you from having to get out in the community to go to those buildings and not be able to get in. So if you would, please use the telephone, call ahead, try to use online measures and accomplish those business transactions. We want to assure all our residents that our public safety, our law enforcement, sheriff's department, EMS and fire, they'll continue to be at full capacity to assist the public as normal. We also encourage people to continue to support our local businesses, especially our restaurants, using precaution measures, of course. Many of our restaurants are providing curbside service, and we ask that you assist in supporting them. Our economy depends on it, so we ask that you remember all of our local vendors, restaurants, businesses, as we go through this together, and that you do support them. So please, again, as Mr. Kirkland said, follow the Alabama Department of Public Health and CDC guidelines. Let's remain resilient and work together. The only way that we can really get through this is to remain strong and remain healthy. So we're asking that.
And then Mr. Kevin Cowper, City Manager for the City of Dothan, talk about city facilities and services.
Thanks, Chris. Just briefly, a couple of new announcements to make on behalf of the city. And again, just in an effort to limit that exposure and public contact, we, effective this morning, have further restricted access to the Civic Center complex. We're asking anybody that has public business that needs to be tended to in that facility that they make contact with the appropriate department, take care of business over the telephone, take care of your business online. Probably 99% plus of our transactions can be taken care of without that public contact. We are putting some protocols in place for deliveries, for example, and certain business transactions that do have to take place in person, bid openings and things of that nature. We're continuing to look forward to our public meetings with the City Commission and other planning commission bodies of that nature. We'll be looking at electronic means of doing those meetings going forward and continuing to put those meetings, broadcasting those publicly as appropriate. Our facility at the police station, the public lobby there, is also restricting access. The magistrate is restricting access and limiting the number of people that can be in that lobby area to conduct business there. We're continuing to provide all of our public service public safety services. Our police are out as usual. Our fire are in place as usual. Our sanitation services are operating as usual. We are experiencing a higher than ordinary volume with our sanitation, and so they are asking for you to be patient if there are any delays with pickup. But we are running our normal routes, and we are at full capacity right now. So just a few things that we're continuing to do to protect our public employees that provide the services to the public. We're asking everybody to stay positive, support the businesses as you can. We're working with the business community in as much as possible to help them serve the public with their goods and services, particularly those that are critical in nature. So thank you.
Thank you, Mr. City Manager. We'll take a few minutes now to open up to questions. Anybody that has questions, just bear with us as we bring the appropriate person up, because we're going to not pile up here together. So anybody have questions to open up with?
Someone texted in and said, what about the hotels? Are they open?
Yes, I don't believe, Mr. Kirkland, I don't think it addressed those right now.
Yeah, the hotels should be open. I think the biggest thing for them, again, is if they have any tight workspaces, looking at their staffing and looking at how they can shuffle those people to keep from having them, be within that 6-foot range on a consistent basis. But right now, hotels should be open, yes, sir.
When you addressed 25 people versus 10, a lot of people are confused on that as well.
Yes. The best way I know how to look at the 25 is, if it's more than 25, it's included in this, and you cannot have those gatherings. If you're less than 25, but you cannot maintain the 6-foot social distancing, then those are prohibited as well. So you have to look at, if it's 20 people, but it's a room this size, you probably could make that happen, but that depends on the activity too. So I would think about the activity, I would think about the length of that activity, the size of the room, and the number of people, and then how do I maintain that on a consistent basis. There are some things that probably will need to be postponed or canceled just because of the space is not there, but you may have less than 25 people.
Perfect. Yes, sir.
Has Houston County been designated as a testing site location yet?
Not yet. I do not have test kits at our health departments. There is still a problem with the supply chain, and that is statewide, I should say nationwide. I've talked with some officials in Florida with the health department, and they have the same issue we do. There is a 188 number that people can call for the nearest testing site. That's on our website as well, and I can give it to you right now. So if someone is in need of testing, they can give you the most up-to-date list. That number is 1-888-264-2256, and that will go to our central office in Montgomery, and our infectious disease staff is manning that line.
I have a question for Mr. Kirkland, and I'll preface my question understanding that you're not making the rules. But a question I've been asked a considerable amount of times. We are closing the dining room of restaurants supposedly because of the proximity of people inside. Is that correct?
That's correct.
Then why are we leaving stores open when people cannot meet each other in the aisle without being within 2.5 feet of each other?
Well, they left grocery stores, and I'll use that as a perfect example.
Other than
But
grocery stores.
I think it was an attempt to scale down the number of gatherings and the number of people when they're maybe there for a certain length of time. If you go to a restaurant, you're probably going to spend 30 minutes to an hour, maybe 2 hours. You may have birthdays or things that you're doing there too. I don't know exactly why some of the ones were left out at this point. This is an attempt to scale back gatherings and scale back that face-to-face contact that is going to help us to end this a little quicker, we hope.
Anyone else have questions? Ms. Deborah?
I've got one for Mr. Kaplan.
Okay.
I've got two for you.
If you can speak up just a little bit, Ken, so a little louder, please.
Well, I apologize. We know tax revenue, sales tax revenues are going to take a dive. because of what happened. How much money does the city of Dothan have in reserve to ride out this winter?
Well, we have more than adequate reserves to ride out this particular storm, and I'll give you an example. Our budget for this fiscal year relies on about $64 million in sales tax revenue. That's what we have budgeted to collect. Our actual collections last year were $74 million, and we're running currently $2.5 million above our projections. So we build in to our budgets very conservative revenue projections so that if there is an event like this, we are prepared and able to come in with a soft landing on issues like that. So we are, we have reserves, permanent reserves built into our budgets for emergency events, and we have very adequate, more than adequate cash flow reserves on hand to weather this.
So let's say sales tax revenues drop 50%. I've had some retailers tell me their sales are down 50%
Right.
more. At 50% of our normal tax revenue, how long can the city of Dothan continue to operate close to what it does now without getting in trouble financially?
Well, it depends how long you're receiving that 50% sales tax revenues for. But say, for example, if that happened for 2 to 3 months, we would go on business as usual. We would barely be recognizable. Our annual revenues would continue to exceed the projections that we had made.
6 months?
Longer than that. I mean, we're in very good financial shape. We will adjust our services if that becomes necessary based on budgetary constraints. We'll do whatever. We have to have a balanced budget. We'll use emergency reserves as necessary if we get to that point. I'm not expecting anything near that at this juncture. We are anticipating we'll see a downtrend in sales tax revenue. Certainly restaurants are going to be taking a hit, but right now grocery stores are seeing increased revenues. How that will balance out, I can't project that right now.
One more brief question.
Yes, sir.
I'm done, I believe. So, did I understand you to say there would be meetings such as commission meetings, planning commission meetings, that would be online only?
Well, what we would like to do is limit attendance at those meetings to those that have business, and the governor did authorize the commissions to meet via technology as opposed to in person, and so we will continue to meet in person as necessary, perhaps once a month, and if we need to do it via teleconference other times, then we will look at that technology. But all of those meetings will continue to be open and broadcast to the public.
And that is, the meeting though they're not in person is allowed because we're in a state of emergency?
That's correct. Yeah, and the governor issued, that was part of an order she issued. Yes, sir. Thank you.
Thank you, sir. Any other questions before we wrap? Excellent. I want to thank everybody again for being here. I think our major takeaways are the public health order issued by Dr. Harris yesterday is all about limiting transmission, limiting us being together in groups of 25 or more or closer than 6 feet. Mr. Cowper and Mr. Judah all expressed when you can to take care of our local businesses, shop local and eat local when that's possible. I'm also aware that a number of people have been calling with questions about what they can and can't frequent, and Mr. Judah said very well, call ahead and ask, whether that's a health care provider or a city or county service. We're very much still operating, still taking care of the public, and especially providing those essential services. But it is 2020. We have the ability to do a lot by technology. So call ahead and let's make sure that we're still taking care of everyone here. We are not anticipating at this point any briefings, face-to-face briefings or in-person briefings this weekend. Should something change from the Alabama Department of Public Health or locally, we will get that out to you, of course, and get that out. We're all still continuing to meet as departments, as city and county, and our joint information group via technology, remotely, each day to make sure that we're staying abreast of what's going on. So we will get out updates out as they're needed. As for now, thank you very much.